All right. This meeting is called to order. Good morning and welcome. This is the last SEB board meeting of the season. Our meetings will continue to be hybrid. Healthcare Authority staff will be on site, and board members and other attendees will have the option of attending on site or via Zoom. For our Zoom attendees, our opening slide has information about how attendees can turn on closed captioning subtitles. We're going to do a roll call vote, starting with Terry.
Good morning.
Good morning. Amy?
Good morning.
Good morning. Pamela?
Morning.
Good morning. Donna?
Good morning.
Myra?
Good morning.
Good morning, Myra. Carrie?
Good morning.
And Allison is, we've gone over that. Somewhere west.
East.
East. And Michael Tunick?
Good morning, Chair McDermott. Yeah, I'm here in place of your regular counsel, Katie Hatfield, who is on vacation.
All right. And Michael's from the Attorney General's office. And I'm Lou McDermott, the deputy here at the agency and also the board chair. With board members attending both in person and virtually, it'd be helpful for the board to hold their questions until each presentation is done or when the presenter pauses to ask if there are questions. Board members attending virtually, we're going to be watching for your Zoom hand. There's going to be several resolutions scheduled for action today, so if the public has an opportunity to provide comments on those specific resolutions during normal procedure before the board votes, the public will also be able to provide general comments at the end of the meeting during the public comment period. And as a reminder, if the public has questions during a presentation, the presenter's contact information is included at the end of their presentation. Just send them an email and we'll capture your question for a response after the meeting. Dave's going to give us an overview of today's agenda.
Good morning, Chair McDermott, members of the board. Here we are at the last meeting of this board season. It's hard to believe that we're already here, but it's an important meeting because good reminder context that has come up in the last week for public members, and this came up multiple times at the PEB board yesterday and last week, is to remind everyone that as we sit here at this exact moment in time, there are no plans for 2024. There does require an affirmative vote each year by the board to authorize the plan and the premiums that go with it. There is no status quo. So, for example, if you didn't vote for any of the resolutions today and a majority of the board didn't vote for anything, there would be no plans offered. And so that's a piece of information that I've come to appreciate, that a lot of members of the public don't know about this process. And it's understandable that they may not know that about this process, but there is no status quo. The status quo as it sits right now for 2024 is there are no medical plans currently authorized to offer school employees during the upcoming open enrollment for plan year 2024. So there are important decisions that need to be made today related to the plans for the 2024 plan year. So Tanya will be back with a little bit of updates on what happened with the carriers as we took the board's request to solicit another round of bid rates from the carriers and present some updated premiums for some of the plans, and then we will present the final resolutions for your action and consideration today. After that, we will begin, we immediately pivot here at the Healthcare Authority to full steam ahead on open enrollment. And so we have Alyssa Richards here to talk about what kind of the transition is and some of the communication plans that we're ramping up related to this open enrollment. Then we will move into a presentation we had originally intended last week about Smart Health and our vendor transition to WebMD that happens at the end of this year. So Kristen's here for that. And then I'll just remind everybody some things about 2024 board season, because as I say, 2024 starts tomorrow. And with that, I'll just remind everyone, bathrooms are down the right. If you see the elevators, look left. And if there's an emergency, we go out to the visitor parking lot. And with that, back to you, Chair McDermott.
All right. Any questions for Dave? All right. Something that came up during, yesterday we had the PEB board meeting, and as we voted on the plans. Obviously, there's consternation with the Kaiser Permanente plans and the rates associated with them. And I kind of forgot about this because we haven't done this in a while, but when I do the roll call vote, I know we sort of whip through it, but sometimes board members in the past have wanted to express themselves prior to their vote. So I know we have a section where we say anything from the board, anything from the public, but before you cast your vote, you can give your preamble if you choose to. And so that's something that yesterday was exercised by the board. As they voted on the KP rates, there was a lot of discussion prior to doing their vote because, again, they're caught between a rock and a hard place. You know, they don't want it to appear that they're happy with the rates by endorsing them, but at the same time, they also know that if those plans don't get approved, then those plans go away. And that impacts a lot of people. So you have multiple opportunities to sort of speak your mind. I just want to make sure I didn't feel like I was ramming the votes through without another opportunity to say how you felt. So just feel free to do that. Of course, the first vote we're going to take is the exception because we say aye or nay on the minutes, but for the rest of it, it applies. Anybody, any questions about that? Okay. So the first thing we're going to vote on today is the meeting minutes from July 3rd. That is amazing. It used to be, you know, now that we've gone to the different sort of format, it used to be a while before we get to it because it was verbatim. The meeting minutes are behind tab number 3. And are there any comments from the board on those meeting minutes? Is there a motion to approve as written?
This is Donna. I motion that we approve them.
Is there a second?
Pam Cruz, second.
All in favor, say aye.
Aye.
Any opposed? Hearing none, to the July 13th, 2023 minutes are approved as written. Back to you, Dave, for general program updates.
Yes, I have. This is usually the time I do follow-up from the prior meeting, but as we're at the end of the board season, there were 2 pieces of information I wanted to share and just give general updates on. The first is related to Benefits 24/7, the IT program and enrollment that we have talked about launching, and I revealed over the last month that we did not launch on June 12th as we had originally intended. So we've now assessed the timing of the launch of the program, and I did send an email to the board about this, so this should be familiar, but I wanted it to be on the public record as well, that we announced that we were targeting a January, too many J months, a January 2024 launch date. And that was really driven by a couple of key pieces of information and conversation with a lot of our employers from the PEB and SEB programs. You know, we serve over 700 employers between school districts, state agencies, higher education institutions, and political subdivisions that contract with the PEB program for access to those benefits. And while we're not looking for shuttle launch conditions, there's 5 perfect days in a year where you can launch a spaceship into orbit. It's not like that, but there are certain times where it's like, probably just not a good idea. And right now, I know I'm looking at Amy, we know that 10-15% of the school employee workforce turns over in the months of August and September as entering a new school year. And we really genuinely did not want to unnecessarily burden benefit administrators with both important eligibility determinations that really do need to be done right, and having people navigate what we think is an intuitive system, but it's still a new system to people, and that would be for all employees. And while there may have been some of our employers who thought that October would be a great month, possibly, we were really concerned about that here at HCA, knowing that we are going into open enrollment, knowing where the rate development process was leading for both programs, anticipating that there will be higher engagement out for the SEB program outside of the initial launch where everyone had to engage. This will probably be the highest involvement, activity, and usage of the system for school employees. And then we also know that we will have a lot of activity in that same system for retirees as well as PEP employees. And it just doesn't make sense to us to have everyone, we want people focused on making sure that they are assessing the plan, comparing the plan, and not tripping over any concern possibly with working in a new system. So that just led us to January is the time. So just wanted to get that on the record and share, and really appreciate that we had a lot of conversations with our employers, including about 24 school districts that we have a stakeholder forum with, and really took into consideration the feedback that we heard there in making that decision for moving into January. The second piece that I wanted to highlight is we are working on a legislative report that is related to both programs. It's the Uniform Medical Plan Third-Party Administrator Report. And this is a report that's required under the budget. We're turning it in, I believe, December 1st this year, and we will bring it back to the board during the retreat and talk about what that report contains and give you a full copy of that report as well. And that's a report that the legislature wanted the agency to look at. There are a lot of functions that are outsourced under the contract to regions. And before 2011, many, but not all of those functions were actually performed in-house at the Healthcare Authority. For example, provider contracting. This agency used to do the direct provider contracting for the Uniform Medical Plan. That is one of the things that Regions does, and that is under the responsibilities of that contract. And the legislature wanted the agency to look at, well, what would it look like? What's the cost benefit analysis, pro cons of moving various functions back in? Now that the SEB program has joined, and we basically doubled the covered lives in the Uniform Medical Plan. It was really kind of is there more efficiencies in one way or the other? And so we're doing that analysis, and I'm going to report that back. It may seem strange as to the timing of that. It's 2023. Why would we do that now? We've talked about procurements and the length of procurements, and specifically the TPA procurement for UMP took about 5 years. We started internally the original conversations in 2014 for a contract that went effective January of 2020. And so the current contract goes through December 31st of 2029 and can be extended into the mid-2030s. So if the legislature wanted to change direction on how we manage UMP and admin functions, it's actually relevant to have that report now and have those conversations in 2024, 2025, so that if there is a pivot on any functions, the agency can do that in time for another contract. So it's just, I know it's counterintuitive to say we're talking about 2030 now, but we are. And I'm still not even halfway to retirement then. So just for the record.
So noted.
Yep. So those are the two updates that I had that were general program, benefits 24/7, UMP TPA, and Dave's long-term retirement.
Powerball is at $1 billion.
Somebody won in California. One ticket.
All right, well, good luck with the rest of your career.
I didn't. Yeah. And I didn't have time to go to California last night between board meetings, so it wasn't me.
All right, any questions for Dave? All right, Tanya, come on up. Megan, are you joining her this time? I think yesterday. Yeah, I think yesterday you did. So.
Only if I need to come up and rein you guys in.
Okay, so Megan will be in the back, ready to go. So Tanya Duell, the Finance Manager in Financial Service Division, is joining us to present for board vote today the 2024 SEB premium resolutions that were introduced during the last meeting. After Tanya reviews each resolution with us, I'm going to ask for a motion to adopt. A second, I'll invite public comment on the resolution. I'll ask for board discussion until we're ready for a vote. When we ask for public comment specific to each resolution one at a time, please make sure you raise your hand to give comments on the resolution that's before us. Tanya's materials are behind tab number 4. Tanya, welcome, and Megan, welcome in the back.
Morning,
Thank
you
you.
guys.
Yep.
Thanks, Chair McDermott, members of the board. For the record, my name is Tanya Duell. I am back this week to bring you the final 2024 PEB premiums and the resolutions for action today. On the next slide, I just wanted to touch on a bit of follow-up. Last week, we presented the proposed 2024 premiums to the board, and we also had Kaiser in attendance to give a presentation regarding their rates. And the board did solicit an additional round of rates from the carriers, and we did extend that to Primera as well. So we did receive both revised rates from Kaiser Northwest as well as Primera last Friday. So we'll walk through those updates today. I do want to note that those do not include updates from Kaiser Washington, as they explained that they made an additional investment before the last round of rates. So the Kaiser Washington rate reductions were included in the last set of rates that we walked through last week. So on this first slide here, we wanted to just do an individual call out for each of the changes so you can see them side by side, comparing what we presented last week versus the rates that were received on Friday being presented before you today. So you'll see for the Kaiser Foundation Health Plan of the Northwest, you will see their 3 plan offerings and 2 sets of rates. You'll see rates presented as of July 13th, the rates you saw last week, as well as the updated rates we received on Friday and are before you right now. And then these rates on the bottom, the rates as of July 20th, will be included in the next set of slides as well. So you can compare how those rates played out. So I'll let you look at those for just a second.
And we did publish these materials per the standard policy. We got them out Monday afternoon, shortly around the same time that you received your briefing books from Jessica. So they were published on Monday afternoon.
All right, and on the next slide here, similar layout, but these are the updated proposed premiums for Primera. There is one plan here in a box that Primera chose to further reduce, and you can see that in that box. their HMO product. All right. So the next set of slides are just a refresh of what we walked through last week, but will include the updated rates in those boxes on each set of the slides. So these are same as we walked through last week. There's no changes to the other plan offerings, but I won't spend a ton of time on these, but I'll just reorient you to each of the set of the slides because there's going to be 2 per type of slide because of the volume of plan offerings. All right, so this first one is just comparing the proposed 2024 single subscriber premium in that first light blue column with the proposed employer medical contribution, the EMC, and then on the far right, that is the total proposed bid rate. The math works by adding together the single subscriber employee premium and the EMC to get the total bid rate, or you can do the opposite, take the bid rate minus the EMC and get that single subscriber premium. And highlighted are those Kaiser Northwest plans that have changed since last week. On the next slide, it's the same view, but including the Premera and the Uniform Medical Plan rates, with the Premera HMO product outlined to reflect their updated rates as of Friday. Okay. The next set of slides were presented last week also. This set of slides compares the single subscriber premium from 2023 compared to 2024, and then the percentage and dollar change, as well as the subscriber enrollment and the percentage of total enrollment that each plan offers. So you'll see here that Kaiser Northwest again is outlined to reflect their changes, and then the other Kaiser offerings are no change from last week. If we walk to the next set of slides, these are the same layout, but including Premera and the Uniform Medical Plan. Premera HMO is outlined here to reflect their change. All right. The next slide is actually new, but I just wanted to bring it back as a refresher because I think there was a little bit of conversation around the tier ratios and how to do some of the math across the tiers. So we just brought back this visual that we've had in previous cycles to show the different tier ratios or tier factors, how you can multiply that single subscriber to get to the other tier offerings. So the subscriber tier is just a 1.0 rate. That's what we've looked at so far. To get the rate for the other 3 remaining tiers, tier 2, which is the subscriber and spouse or state registered domestic partner, you times that single subscriber rate by 2. For tier 3, which is subscriber and child or children, you multiply that single subscriber rate by 1.75. And then for tier 4, which is the subscriber, spouse, state registered domestic partner, and child or children, you multiply that by 3. And those last 2 tiers do not change regardless of the number of children you have enrolled on your plan. So the next set of slides walks through those 4 tiers, and we also added the tier ratios across the top just for easier math. So this looks at the rates we just saw, but looks at all 4 tiers. So you can see this is the Kaiser offerings with Kaiser Northwest outlined again here to reflect their changes across all 4 of the tiers. So you can see from the single subscriber to the full family tier, the range there. And on the next slide, same as last week, but includes the update to the Premera HMO. I want to pause here for rates and see if there's any questions. Okay. We do have time still throughout the presentation if you think of something. Next up is the UMP Plus service area change. Last week, Beth presented on the plan design changes for all of the plans, and Dave spoke to this additional UMP Plus service area change that was not included formally in the slide deck, but we did want to just, bring it back formally and include it in the deck for reference. So that is documented here. And then the next slide, I think, Dave, you're going to talk a bit about the resolutions and how they've changed since last week.
Yes. So at last week's board meeting, one of the things that was brought up, and by both boards actually, was concern about the use of the word endorses as being a much more positive sounding affirmation of rates that many people were frustrated with, understandably. So we went back, looked at our thesauruses, consulted the statute about what the PEB board's authorities and responsibilities are, and identified that our recommended word that is more neutral would be authorizes. Again, there were a couple of words, and people have suggested some various words like acknowledges or accepts. The very nature that the board has to kind of affirmatively take a step to make a plan offered with a rate suggests something a little more than acknowledges. And so, I recognize authorizes it is more neutral than endorses. It may not make everybody as comfortable, but we really were trying to balance that affirmative action that is required by the board with something that is more neutral. I do anticipate that going forward, we will just bring resolutions that have this. As I said last week, that we use that word because it's the word that's always been used. And until something comes up, you don't necessarily think about for the full meaning of some words. And now we have new context and new learnings, and so we'll just bring authorizes. So that's the shift that happens there. Chair McDermott mentioned this at the beginning, that there is always an opportunity as you're taking your votes, either before, during board discussion, or immediately preceding your vote, to give context to your vote. We've definitely had that in the past, and just wanted to highlight that and prepare people to know that that is always your right on any vote. And then as we go through the resolutions, any changes to what was presented last week are in red text. The original versions are in the appendix. Generally, you're just going to see the word endorses change to authorized, and then for Primera and Kaiser Northwest, you will also see a reference to the date the rates are presented, because if someone were to go back and look through the materials, we want it to be very clear which Kaiser Northwest rates were the ones that were approved. And so that is additional language that's used, and we've done that before with this board when we've had a similar situation several years ago. So that's what we have back for you. These are carrier. Do you have a good line that you talk about what these
Sure.
are? So
Yeah.
I'll turn it back to you.
Okay.
One sec. And to that point about the word, one of the things we talked about during the PEB board is that, let's say, for example, you wanted to use a different word. Then we got to do a motion, a second. We have to do all this rigmarole. We have to take a vote, and then that goes in. Then someone else can say, no, I want to use this word, and then we have to determine whether that word meets the threshold. So again, we sort of preface that with the board, so they had an opportunity to express how they felt about the vote before they made the vote, and they can use whatever words they want during their expression as long as their vote is for or against. So that's kind of a deal. Yes.
Quick question. Are we going to have an opportunity as a board to discuss all of this before we get to the procedural?
Yes. So what we're going to do, there's going to be a motion to adopt, a second, then there's going to be comments from the audience, so the board has a chance to hear what the public thinks. Then the board is going to talk. So then we can have a discussion, and then we're going to go into vote. And then again, at the vote, there's an opportunity to express yourself prior to casting your vote.
All right.
Okay.
Thank you.
And also I think anytime the board wants to talk about something, I don't think it really matters what step we're in. We just raise our hand and just say we want to talk. So there's nothing really stopping us besides the clock, and I think we've got a lot of time for today's meeting.
All right. So given that, just a little bit more detail on how these resolutions are drafted. If we go to the next slide. I will not go through each resolution individually because they're very similar. So I do want to remind the board that as drafted, how these resolutions work is that by the board adopting these individual resolutions for each carrier, they're carrier by carrier resolutions. You're adopting the underlying plan design that was presented by Beth last week, as well as the rates that we just walked through today, and as well as some of those were last week. So by the board adopting these resolutions, it's adopting all the plans within the carrier, as well as the plan design and the underlying premiums and rates. So the first one, how this one is laid out, this is for the Kaiser Foundation Health Plan of the Northwest. And like Dave mentioned, in red, you'll see as presented on July 20th, because the rates for Kaiser Northwest have changed. Also in the title, you'll see health is red. That was just a typo from last week. So I won't go through each of these. I'll actually pass the baton back to Chair McDermott to walk through each of these, but that's how these resolutions are structured.
One more thing, Chair McDermott, I just because I think this is important for the public to understand too, and some board members have asked this in both boards actually. We set up the votes and resolutions carrier by carrier, so there are 5 for you today. Because otherwise we would set up 17 votes, 1 for each individual plan. If there is ever a point in a board season this year or even next year, just for general awareness, that the board wants to not approve all plans, but wants to approve a subset of plans, then we can work, I would appreciate that feedback along the way as we're going through the rate setting process, and we can work on resolutions that achieve those goals. We've just set it up for a smaller number of votes, thinking that there is generally not a reason to distinguish between individual plans, but they can certainly be crafted or amended or written in a way that could authorize specific plans if that's the board's desire at some point. So just wanted to put that out there for general awareness as well.
Any questions for Tanya? All right, we're going to take a vote on Resolution SEB 2023-08, Kaiser Foundation Health Plan of Northwest, 2024 premiums, medical premiums. Resolved that the SEB Board authorizes the Kaiser Foundation Health Plan of the Northwest 2024 employee premiums as presented on July 20th. Is there a motion to adopt? Can I make a motion to adopt?
Sure, can you?
I'll make a motion to adopt. Is there a second?
I'll second.
Any comments from the public? Seeing none? Any comments from the board? Yep.
You knew we were gonna do this.
Yeah, understood. Rightfully so.
I appreciate that Kaiser Northwest came back with, I would call it a less bad bid. It was better, but not much. The percentage increase makes me sick. I can't look any of my friends in the eye and say this is a good idea. I truly feel that Kaiser has us over the barrel, and Kaiser is controlling this conversation rather than this being about educators who need healthcare. And that percentage, over 100% increase, is ridiculous, and I'm going to have to vote no.
Other board members?
This is Myra. Again, I like the word appreciate. Thank you, Pam, for that. There was a lot of work done on this, and I was happy to see there was some movement in our direction. But my fear is we are going to lose people that want to join our educational field based on these types of rates. Specifically, people of color are going to choose a different profession, and we need them in education. And I know that it's broad to say, well, how do medical plans matter? But they do. It's a huge incentive for people to join a career. We are seeing people leave early, specifically people of color, students or workers that are first generation coming into the field. They can't afford to live on their own. They're living with families. They are taking care of families. And they just say, I can't afford these high rates. So I do appreciate them coming back to the table, and I appreciate all the work. But this is a hard, very hard pill to swallow. Thank you.
Thank you, Myra. Others? All right, this is going to be a roll call vote, starting with Terry.
After reading all the correspondence and seeing how this would affect a good number of classified employees, which I represent on this board, I'm going to have to vote no.
Amy.
As a benefit administrator, I work with employees very closely. And as much as these rates anger me and upset me because it does affect our employees and their, in the end, their pocketbook. And that's hard because there are lots of people in the school district who are not paid very much, and this is going to affect them. However, on the other hand, like Dave said, I worry about the employees who do have Kaiser and who are going through health crisis and depend on Kaiser for their medical insurance, and voting no could cause us not to be able or not to have Kaiser anymore. And that, I think, is scary for those who are in the Kaiser program right now and depend on it. So for that reason, and thinking about all the employees who come to me with even health issues they talk to me over that they've got going on, I vote yes.
Carrie?
I find these rates extremely concerning. And I worry not only about the Kaiser plans, but about healthcare costs in general. I think we need to continue these plans at least for the next year. There are people depending on them. They're in the middle of procedures or whatnot that they might need to continue, and it might make sense for them to pay this extra amount. But I think we need to give considerable thought to what kinds of health plans we support and provide in the future. We need to find, not only for Kaiser, but for every kind of plan that we offer, something that is more affordable. We need some different answers. And so I will vote for this plan this time, but I think it just opens up a huge discussion that we need to have.
Thank you, Carrie. Myra?
Thank you. Again, I spoke already, but I also have the side that having no plans is more impactful on many more than having a real expensive plan. So I guess I look at it as I'd rather be driving a Tesla than walking. So I vote yes.
Pam?
No.
Donna?
I'm a librarian, and if someone came to my library and said, I want to remove this book, that takes the choice away from all those other people. And I kind of feel along the same lines when it comes to the healthcare. I would love to vote no to send Kaiser a strong message, but like Amy said, there's people that need Kaiser. There's people that may be in the middle of a pregnancy and they want to continue. So no matter how strongly I want to tell Kaiser that these are exorbitant rates and they're out of the reach for a lot of our classified staff, it is like a book. I'm not going to take that choice away from other people. I'm hoping the marketplace will take care of itself, and so I am going to vote yes.
And before I vote, as the deputy of this agency and as the board chair, I have an expectation that our communications plan to our members is going to be the best it's ever been. That we're going to get to people so that they understand what is happening, because it's one of those things where people don't open their mail, they don't do this, they don't do that. So I'd like us to do everything we can to make sure people know what's going on and that they have a choice. Because that's kind of what we're all pushing here, is freedom of choice despite these massive increases. So based on that, I vote yes. And the resolution passes. Next up, Resolution SEBB 2023-09, Kaiser Foundation Health Plan of Washington, 2024 medical premiums. Resolved that the SEBB board authorizes the Kaiser Foundation Health Plan of Washington 2024 employee premiums. Is there a motion to adopt?
I make a motion.
Is there a second?
This is Donna, I second.
Are there any comments from the public? Seeing none, are there any comments from the board?
Can I ask a procedural question?
Of course.
Just because of the charts we've been using, says like Core 1, Summit, Sound Choice. Which of those is this one?
Those are the core and sound choice, and then the next resolution will be the summit plans.
Thank you.
And Pam, that's a really good piece of feedback for us to think about how to structure these resolutions a little more clearly for everyone going forward.
I think we just say Kaiser Northwest. We just
Yeah.
throw it out there rather That's why I wanted to ask.
No, it's a great, all the times I've looked at these, I never thought of that question. So I really appreciate that clarity on the record.
Thank you.
Any additional comments from the board? This will be a roll call vote again, starting with Terry.
No.
Amy.
I just want to say again, I am not happy with these. But like I said before, I can't take away something from employees who may need it. So I'm voting yes.
Carrie.
I'm voting yes for 2024 with the hope that we are going to largely explore different options, different approaches to healthcare in the future.
Myra.
My vote is yes.
Pam.
No.
Donna.
Same thing I said on the last one, yes.
And Lou, yes, with the same caveat. Resolution SEB 2023-09 passes. Next up, SEB Resolution 2023-10, Kaiser Foundation Health Plan of Washington Options, 2024 Medical Premiums. Resolved that the SEB Board authorizes the Kaiser Foundation Health Plan of Washington Optics.
Said optics.
Oh, I'm sorry. Options, maybe I should go get, yeah. Yeah, no, I got them, but I think I need to go up a 0.25. Yeah, options in 2024 employee premiums. Is there a motion to adopt?
I make a motion.
Is there a second?
This is Donna, I second it.
Are there any comments from the public? Seeing none, any comments from the board? This will be a roll call vote, starting with Terry.
No.
Amy.
Yes.
Carrie.
Yes.
Myra.
Yes.
Pam.
No.
Donna.
Yes, along with the same comments previously.
Noted. Lou, yes. SEB 2023-10 passes. Resolution SEB 2023-11, Primera 2024 medical premiums. Resolved that the SEB Board authorizes the Primera 2024 employee premiums as presented on July 20th. Is there a motion to adopt?
Pam Cruz, so moved.
Is there a second?
This is Donna, I second it.
Any comments from the public? Seeing none, any comments from the board? Seeing none, this will be a roll call vote, starting with Terry.
Yes.
Amy.
Yes.
Carrie.
Yes.
Myra.
Yes.
Pam.
Yes.
Donna.
Yes.
And Lou, yes. Resolution SEB 2023-11 passes. The board is in harmony again. Next up, Resolution SEB 2023-12 Uniform Medical Plan 2024 Medical Premiums. Resolved that the SEB Board authorizes the Uniform Medical Plan 2024 Employee Premiums. Is there a motion to adopt?
Pam Cruz, so moved.
Is there a second?
This is Carrie, second.
Any comments from the public? Seeing none?
Chair
Any
McDermott, I'm going to jump in here for something. I realize there's something we needed to highlight specifically. If we can go back to slide 8 for a moment. I realize it was really important to put this on the record before you actually voted. There was a typo and the one we're showing right here is the old version. For people who are viewing in the public, what I wanted to highlight is something that was a typo that's still showing on the visual right here. If you look in 2023's column at UMP Achieve 1, it says that the current rate is $44 per month for a single subscriber, and that next year's proposed is $44. It's actually $42 today, proposing to $44 for 2024, and that represents a 4.8% increase and a plus $2. So that first row was incorrect because we unfortunately did not describe 2023's rates, premiums correctly last week. We've updated it. The materials online are updated. Your board materials are updated. We pushed out that notification. We just missed it for the one that's visually here, but I did want to highlight that there is actually a $2 increase that is with UMP Achieve 1.
So with that correction, we'll go ahead and let's start this over. Is there a motion to adopt the corrected rates?
Pam Cruz, motion to adopt the corrected rate.
Is there a second?
This is Carrie, second.
Any comments from is procedurally we okay, Michael?
Yeah, procedurally
good.
okay. Yeah.
Any comments from the public? Seeing none. Any comments from the board? Seeing none, this will be a roll call vote, starting with Terry.
Yes. Yes.
Amy?
Yes.
Carrie?
Yes.
Myra?
Yes. Yes.
Pam?
Yes.
Donna?
Yes.
And Lou, yes. Resolution SEB 2023-12 passes. Thank you all. I know that was difficult. I do appreciate it. Back to you, Tanya.
Yep. One final thing before we wrap up today. Thank you for your patience on this. We had one typo last week that I spoke to verbally about the vision rates, and we just wanted to formalize that by including the slide here after the resolution in the deck, and these align with the rates that I spoke to verbally last week. So,
Who pays vision?
and the employer pays vision 100%, so should not impact employees.
All right. Any final questions for Tanya? And Megan didn't even have to come over here and bail us out. That's nice. Nice job, Tanya. And Megan's gone, so hey, it wouldn't have mattered. All right. Open enrollment preview. Alyssa Richards, Benefit Account Section Manager in ERB, is going to present on the agency's efforts as we prepare for open enrollment. Her materials behind tab number 4. Alyssa, welcome.
Good morning, Chair McDermott and members of the board. For the record, my name is Alyssa Richards, and I'm the Benefits Account Section Manager. I'm here today to give you a preview of the open enrollment strategies in the Employees and Retirees Benefits Division. So open enrollment planning activities actually start months before open enrollment, the actual open enrollment period. Many divisions within the Healthcare Authority work together to plan for that successful open enrollment. This year's open enrollment for SEB will be Monday, October 30th through Monday, November 20th. In March, we begin meeting with various areas of Healthcare Authority to discuss open enrollment activities. These planning tasks include communications materials, planning for enrollment system updates, etc. Starting in April, the planning for upcoming benefits fairs also begins. The outreach and training team facilitates these discussions and starts planning for the number of fairs, locations based on member enrollment data, securing venues for the benefits fairs, and working with internal staff to plan for support on site for each fair. In June, the ERB communications team finalizes their communication plan for the upcoming open enrollment materials. In July, the board votes on premiums, which kicks off our ability to finalize those materials for open enrollment. In August, the HCA Finance and Communications team finalizes rate sheets, and the communications plan gets finalized based on decisions that were made in July. This year, our member communication strategy has shifted based on significant changes, and we want to make sure members are aware. At the end of September, we will start our communication strategy by sending a postcard to all members to encourage them to look at the changes in premiums and benefits for the 2024 plan year. And in October, we will send weekly notifications to members about open enrollment, which I'll share more in an upcoming slide.
You'll note for the board that Alyssa did say postcard because that doesn't require you to open an envelope. And so we really are thinking about a variety of different ways that people will engage and really, that's just a very small piece. That's why we're starting with a postcard, because it doesn't require anything other than actually taking it out of your mailbox. My hope is that by the time we get to open enrollment, it's kind of like election season where you're like, oh, another flyer from HCA.
And I think it's also going to be key for the employers on the PEB side and the SEB side to communicate with their staff. Mm-hmm. And that's something we need to push with them very strongly because you're right, mail it's a tough thing. Mm-hmm. Absolutely.
As a benefit administrator, I do want to say the Healthcare Authority emails that they send benefit administrators that are already written, and because September, October, November time is extremely busy for benefit administrators with employees coming in, last minute hires, those kinds of things. So those emails that are sent to us that we can just technically forward out are extremely helpful, and I hope that there are plenty of them coming.
I have a question in state service, we have a lot of, like our HR folks get together across agency lines, our CFOs do that, our IT folks do it. Do the benefits administrators all get together as well, sort of outside of the healthcare authority and with each other to talk about how things are going?
Not necessarily. We used to at the beginning of SEB, but it's kind of calmed down, and so we don't do it as often, or haven't done it in quite a while now.
Is there a
But
distribution?
there are conferences that a lot of times that we go to and we see each other and talk,
Okay.
but.
So there might be some other opportunities, some other venues for getting the word out.
And HCA does, I believe, since just before the sub-program launch, that we've traditionally gone to the benefits WASBO conference that is usually in the fall, and provided support to benefit administrators there about the changes that are coming. That's not a direct member piece, but it's the supporting of benefits administrators.
I think the union's a good avenue as well.
Mm-hmm.
Yeah.
That's why I have my hand up.
Yeah,
That's
yeah.
the next option, is definitely the bargaining units and the unions.
Yep.
And we have a convention coming up, and this will be a lot of, part of the discussion.
Okay, excellent. All right.
I'll just note that we did take note that the letter that came from the coalition, the labor coalition that we provided you last week, noted that there would be support from the coalition for communications, and we have a regular cadence of stakeholder relations with the coalition, and we will certainly work together. One of the things that we often do is, I'll just use the postcard as an example, is we'll give PDF, printable, mailable user version of that to other organizations. Say, if you just want to prepackage and use this, use it. And so we will collaborate. That's something that we've traditionally done. I think that this year more than ever, with all of our various partners, whether they're benefits administrators, labor partners, everyone will be able to access the materials that we're using to also replicate and reuse them and work on that messaging.
Yeah, I'm thinking back to when we launched the UMP Plus program. Labor was involved in that dissemination of the message. So, okay, excellent. Alyssa, back to you.
Okay. Thank you. Great discussion. So the outreach and training team works directly with SEB organizations, benefit administrators. The team supports over 700 PEB agencies and SEB organizations. They provide training to organizations regarding program plan options, covered benefits, eligibility, rules, and enrollment processes. In turn, organizations act as the first line of customer service for their employees. When benefit administrators need assistance, they will reach out to the outreach and training unit for support, either by calling the dedicated toll-free line or sending a secure message through HCA support. The team does work on open enrollment activities year-round for strategies and process improvements, and we use member feedback to help with those planning activities. Right. The customer service unit is the first line of contact for retirees and continuation coverage enrollees. Staff perform 3 primary functions. They answer a toll-free line and respond to HCA support inquiries, provide in-person lobby services for walk-in members, and review members' retiree or continuation coverage eligibility as they process enrollment forms. During open enrollment, any changes requested by retirees or continuation coverage members are submitted on a paper form, and customer service staff enter those changes manually into our enrollment system. The customer service team has 27 customer service Mass 3 positions, which are all currently filled. Of those 27 positions, 20 staff will be fully trained by open enrollment. The remaining 7 staff will be in various stages of training, but will be assigned specific tasks that will support retirees and continuation members. Okay. Every year, the Outreach and Training Unit conducts webinars for benefit administrators to help prepare them for open enrollment. They will be offering 4 webinars, which will be recorded and later posted on the Benefits Administrators Training webpage. Once the dates of the webinars are finalized, they will be shared and advertised with benefit administrators. The Outreach and Training Unit will provide forwardable email messages to the SEB benefit administrators, who in turn send them out to all employees. These messages include important information such as open enrollment timelines, changes for plan year 2024, and information about how to make changes during open enrollment. Benefit administrators communicate with outreach and training through the HCA support portal, and our communications team is currently leading a project to make updates to that external HCA support portal to improve that process. Last year was the first year we offered in-person benefits fairs since the fall of 2019. We received a lot of member feedback, which we used to start planning fairs for this year. Based on member feedback, we increased the number of fairs from 8 last year to 15 for this year. Locations for this year's benefits fairs were selected based on member enrollment data, which I've also included on the next slide. We won't go there quite yet, but on the next slide, I've included the dates, times, and cities of those 15 fairs. During the earlier fairs last year, we did have printed materials available. We did not have printed materials available, until November 1st. Based on feedback we received, we are working with our communications team to have those materials available at the first benefits fair as well as on our website. We're also planning to increase our staffing at the fairs to help support the needs of our members. So we started planning earlier for more of our program staff to attend to address member questions. And then this year we will again offer the virtual benefits fairs. So virtual benefits fairs is an online website created with the same goal in mind as an in-person fair. Some of the features include, members can learn about their benefits from home. It's available anytime, day or night, and they can access it via a computer, tablet, or smartphone. And some carriers provide direct interactive webinars, pre-recorded webinars, and teleconferences to share plan-specific information. The next slide. So as I mentioned, on this slide, you'll see the dates, times, and cities for those 15 fairs. Okay. Earlier this year, Christine went over our typical communication strategies, but we've added additional strategies based on the changes to premiums and benefits for the 2024 plan year. We are planning for weekly notifications to members to remind them to review upcoming changes. Our first mailing will be a postcard, as we mentioned previously, sent at the end of September to all members to alert them of changes to benefits and premiums. We'll have increased social media posts, forwardable email messages shared with employers for them to send to employees, an alert banner in SEBB My Account, as well as the open enrollment webpage. We'll also include a website alert on the front of hca.wa.gov so members can easily go to the open enrollment web pages to view important changes. We'll be using the October newsletter to call out information members need to be aware of when considering plans for 2024. The front page will describe the steps to take to make enrollment changes and include prominent alerts about premiums and benefits changes. There are some ways that a member can prepare themselves for open enrollment. We know some members may want to change plans based on their individual needs. For members considering changing their plan, the best way to prepare is to make sure they can log into their online SEBB My Account and make sure that the information such as their home address is correct. Consider signing up for email communications. Prepare a list of important questions they may have for plans about benefits, prescription costs, deductibles, etc. HCA will be creating a list of potential questions members may want to ask plans when comparing. Members know their needs better than anyone, so it's important they are engaged in comparing plans that best meet their individual circumstances. Members should also make a list of their prescriptions so they can work with plans to understand how they would transfer their prescriptions, as well as prescription costs and what those might be. And then reviewing changes in our mailed material as well as on our open enrollment website. Next slide. Once members have reviewed changes for this year, they should, if applicable, change plans or waive coverage, add or drop dependents, attest to surcharges, if applicable, elect flexible spending account or limited purpose FSA dependent care assistance program, complete their Smart Health incentive, review life and long-term disability coverage, designate beneficiaries. We will include these member checklist items in our open enrollment communications to help members make the best choice for themselves and their family. And that is the end of my presentation. Are there any questions?
Any questions? Alyssa, thank you. Next up, Kristen, Wellness Manager in the Employees and Retirees Benefits Division, is going to provide us with a Smart Health update, which includes some information on our transition to our new wellness vendor, WebMD. Materials are behind tab number 6. Welcome.
Thank you so much. Good morning, Chair McDermott and members of the SEB board. For the record, my name is Kristen Steimanoff, and I'm the Washington Wellness Program Manager. And as Chair McDermott said, I'm here to talk to you today about Smart Health, and I'll spend most of my time talking about the transition of Smart Health to WebMD as the wellness vendor. So I'll start with a brief follow-up to what I shared with you during the April 6th meeting, and then spend most of my time on that transition. So in April, I shared with you our Smart Health participation numbers over the past 3 years, and we have had some disappointing dips, particularly between 2021 and 2022. And as I shared during that meeting, there were 2 key changes that we believe really contributed to the decrease in the number of people participating in Smart Health and qualifying for their wellness incentive. So the first event was the transition from the Limeade Classic platform to Limeade One, and we felt that transition was positive. There's a lot of new functionality there. There are a lot of good things that people can do, but it required a new login process, and a lot of people haven't come along yet. So that was something that happened in April of 2022, and we're still working to bring people along. The second event was in October of last year, and that was when Limeade came into compliance with the Washington State Office of Cybersecurity's requirement that online applications like Smart Health have to be accessed via SAW, or Secure Access Washington. And a lot of people had trouble with that, and are still having challenges with that, but SAW is definitely not going away. Lots more applications are requiring it, so we'll be continuing to support people with SAW and help now and into the future.
I'll just add that, that was definitely a challenge for both programs. I think when we looked at the data, though, there was a little bit less challenges in the SEB population because SAW was in front of the original SEB My account as people were engaging with their initial elections for the program launch. So while there was, obviously with a 10-15% turnover within the school employee population every year, there was definitely a sizable portion, but it wasn't the entirety of the population, which was the case for the PEB program. So just wanted to highlight, there are still differences between the programs. SAW can be challenging for people. And I do think that as more and more systems have been put, Chair McDermott said this yesterday, so I'm just going to steal his, but give him credit. See, that's how you cite properly, verbally, looking at my library, I'm going to cite verbally, that more and more things are being put behind SAW for having security, and as more and more things are behind it and people have challenges with it, that's prompting, we believe, some central review at WATEC about, some user enhancements possibly in the future. So because of the amount of programs and applications that are behind it now and more people engaging, it's prompting that usability kind of assessment. So just wanted to highlight that.
Thanks, Dave. That's a good point. I think it was a little less painful for SEB to transition to SAW than for PEB.
I will say it was no one will be surprised that some of us are procrastinators, myself included. If you didn't sign in until November, then you got the double whammy of both of those at the same time, the shift to the new platform and SAW if you hadn't been in SAW before. And I can tell you personally that was challenging.
It was a lot to digest and act on if you were doing it in late November. But so had explained that in April, and what I really want to follow up with you today is let you know that we have 5 months left to help people qualify for their incentive, which gets applied next year, and I'll talk in a little more detail about that to remind you if you don't remember the details. And just wanted to let you know some of the things that we're working on to really do that this year and make sure as many people as possible can use Smart Health to take care of themselves, to qualify for their well-being incentive, and not leave money on the table, as Director Birch often likes to say. So one of the things that we did was we sent an announcement to all SEB employees in the May Intercom newsletter, brief announcement reminding people about the Smart Health Wellness Incentive and directing them to the website that gives lots of details about how to qualify and the deadlines. There is a nudge on the Smart Health homepage, so if you haven't done your well-being assessment yet, every time you log in, you're going to see something reminding you to do it, and that will stay there until you do the well-being assessment. We're sending lots of reminder emails, including those forwardable messages to wellness coordinators and benefit administrators. At the beginning of June, this is something we do uniquely to the SEB population, but we put together a flyer that we title Stay Well During Summer Break, and it gives a list of activities that'll be active throughout the summer and give employees a chance to think about, even if they are going to be not working during the summer, there are things you can do in Smart Health to earn points, take care of yourself, and qualify for your incentive. So we like to do that in June before a lot of the school employees go on break. In August, as people are coming back, because we hear, don't talk to me in September, I have got way too much going on. But in late August, we're going to be sending an email to all registered Smart Health users. So this isn't something that benefit administrators and coordinators are going to have to forward. Anyone who's already registered for Smart Health is going to get an email directly from Limeade reminding them about the incentive deadlines, logging in through SAW, and how to get into the platform if they haven't been there already. And in September, we're sending a flyer, and this again is going to be a forwardable message to wellness coordinators and benefit administrators called Reward Yourself with Smart Health, and gives kind of, a push in the fall as you're getting close to the deadline, which is November 30th for most, reminding people this is what you've got to do, and here are some ideas for how to get there. We've been working closely with our statewide business resource group partners. I want to tell all of you about that because even though they are technically aimed at state employees, the statewide business resource groups, they're coordinated through the Office of Financial Management. They're groups that are organized by employees who have a certain particular interest. So there is one for veterans, there is one for LGBTQ plus populations, there's a Latino Leadership Network and Washington Immigrant Network. There are, I think, about 9. But we've been working with them to really, truly deepen diversity, equity, and inclusion in the Smart Health platform, and we feel like anything we do with them is of benefit to the broader population. And, by the way, if you're interested in their meetings, they are open to the public. There are just some narrower membership opportunities. So if you ever see a post in Smart Health about the statewide business resource groups, SEB employees too are welcome to check them out. They just might not be able to become members. But we had 2 posts in June that we collaborated with the BUILD group, which stands for Blacks United in Leadership and Diversity. And we did one on Juneteenth, and that was viewed by a lot of people and deeply viewed, not just clicked on and then clicked away. And we had another one in June that we worked on with RAIN, which is the Rainbow Alliance and Inclusion Network representing LGBTQ plus populations, commemorating Pride Month, celebrating Pride Month. And that, again, those 2 were among the top 3 most paid attention to posts in June. So really glad to be working with these networks to really sort of deepen, especially that inclusion and belonging and really wanting people to feel themselves and their priorities reflected in Smart Health. At the end of the year, we're going to do the giving campaign that we've done for the last few years. It's the title of the activity is called Give to Others for Your Well-Being. People can donate, people can volunteer, people can just help a neighbor, but the idea is by helping others, you help yourself in many ways, including getting 200 points toward your wellness incentive. And finally, we'll do a final push at the benefits fairs. We'll help people understand what to do to qualify for their incentive. We can help people log on if they haven't gotten around to doing that yet. And we're also going to use that benefits fair to generate a little bit buzz for our upcoming transition to WebMD. The last thing I want to mention to you that is not on this slide, because we've talked so much about it in these last 2 meetings, and it's so important, we will be using Smart Health to communicate with people during open enrollment about the importance of looking carefully at your plan options and making an informed choice. There is a lot of communication that's going to be happening on all fronts at the agency, and Smart Health's going to be included in that.
Yeah, board members might remember as we've transitioned to the LTD benefit being opt-out instead of opt-in, and in the PEB program, when we rebooted the life insurance benefit, we use those opportunities to create communication tools within Smart Health. It's like, oh, how much life insurance do you need? And work with MetLife to create a calculator tool or leverage their calculator tool and advertise it. And so we do use Smart Health also as a give points for communication strategy on important things. And OE is obviously going to be a very important thing this year. So that will be another part of the toolbox.
And as we're telling people to take a look, let's make sure we caveat that with the sort of the reason why, that there's been some significant movement in the rates.
Sure.
And, they should take a look, not just like
Yeah.
every year, because it is
For
important every year
interest.
to look,
Yeah.
but this year especially.
Because of the rates.
This year especially.
Okay.
Yes?
I'm gonna publicly admit, I haven't done it yet.
That's great. You're not alone.
Right
So-
in front of the manager.
No, I am modeling good behavior because I'm going to encourage all my friends to do it too. Tell me exactly where I need to go. Tell me the site, the link. What do I need?
Great.
So I can do this.
Okay. If you haven't done it yet, go to the hca.wa.gov
All right.
website and type in accessing Smart Health.
Okay.
And we have an accessing Smart Health guide
Uh-huh.
that is very long and involved and is going to walk you through all the steps you need to know for how to get onto Smart Health. It's going to talk about getting onto SAW. And then you're going to create an account in Smart Health. You're going to link it to your Secure Access Washington. Do you already have a SAW account, Pam? Anyone who hasn't?
I have no
Okay,
idea
so
what
you'll need
you're
to set
talking
up a
about,
SAW. Okay, you'll
Well,
get.
and I figure I'm asking these questions
It's
because
great.
you're talking this and Limey and all this. I'm like,
Yep.
my friends all have no idea. They're like, Pam, give us the link. Give me the
Good.
link. And that's really what, I think that's what it gets down to. We
Yes.
talked about, we can talk, we talked earlier about verbiage and vocabulary. We want to make it as simple as possible.
Absolutely.
Because I think I did this like years ago or a couple of years ago.
There it is.
Oh,
So you go to the
See, I-
HCA website and you type in just what she said.
Okay.
And then accessing Smart Health Guide.
And then just go through it.
Boom, right there.
love it. Okay.
Yeah. You're lucky that worked.
I am lucky. I am lucky. I don't like to tell people about things that don't work. So, yes. So look for that Accessing Smart Health Guide.
Okay.
And contact me at my contact information at the end of this presentation if you have any trouble whatsoever. We are standing by to help. But no, we really want all people to understand this. And just to make sure to level set a little bit, if there's anyone who doesn't fully understand what it is, Smart Health is a voluntary wellness program that's available through your SEB benefits. So there are sort of three key wellness programs that are available through your SEB benefits. Smart Health is one of them. The diabetes prevention programs are one of them, and the tobacco cessation programs. The diabetes prevention and tobacco cessation are linked directly to the health plan. So it depends on what health plan you have, the sort of specifics, but they all have similar benefits. Smart Health is the same for everyone, except that there's a lot of customization that happens in Smart Health. So, depending on what plan you have, you're going to get information about certain benefits within your health plan. Depending on what specific employer you work for, there might be custom activities that only go to your school district. We have a couple that are going up in the next few weeks that are pointing to specific EAPs, Employee Assistance Program, for specific school districts. So it's voluntary, nobody is required to participate, but I promised I would tell you about this, so I'm going to tell you now because the timing is good. There is a wellness incentive. It's modest but real. If you complete a well-being assessment every year and participate in enough activities, and the activities can be as simple as learn about the diabetes prevention program, learn about open enrollment, explore your benefits. You get points for everything you participate in, and if you get up to 2,000 points, and the well-being assessment alone is 800, so that gets you real close. By the deadline, which is November 30th for most people, but December 31st for newer employees, and this is all laid out in the details, then you get $125 off of your health insurance deductible in the following year. So if your deductible is $250, it'll be $125 next year if you did the requirements in 2023. really important note, because this came up in the meeting yesterday, that incentive follows the person, not the plan. So if anybody changes plans, they are still going to get that incentive applied to their health insurance deductible next year. In the case of people who have a high deductible health plan, instead of getting $125 off their deductible, that $125 gets deposited right into their health savings account. So it's actual cash money. But either way, it's money that you either don't have to spend or get to spend, as long as you meet the requirements this year.
And there was a Dave caveat to that.
The one caveat, you did a really good job on all the various ways. The one caveat is to remember that it follows the person, the incentive follows the person. But if the person waives their benefits, then they don't receive the incentive. So they still, in January, they have to be enrolled in a plan. And if they cease employment and their benefits end on December 31st, then they're not enrolled in a plan in January when the incentive's distributed. So it follows the person, but you've still got to be eligible and enrolled in a plan in January when the incentive is distributed. Otherwise, you don't get the incentive.
And Donna has a question.
Oh, not a question, a comment. Kristen and I are good friends. To be vulnerable, I'm a smart health junkie. People in my union, they don't, the conversation isn't over until Donna ends it with, and don't forget to do your smart health.
On it.
Okay, but I'm gonna be vulnerable, and if you search on YouTube, there's actually a commercial out there for smart health, and I'm in it.
Donna's in it. Donna's one of our champions.
Yeah, so if you guys want to look it up, just do YouTube, do a search for smart health, I don't know, but it's in there somewhere.
Yeah. I'll tell you, when we first launched the program, we got the governor to do a video, and his time is extremely tight. So when you interact with the governor, there's all these people there, and they're like, you have 11 minutes exactly. 4 hours later. And they were mad, because they're just like, this has to end. And the governor is very health conscious, very into this, and he gave us 4 hours of footage, which I think we're still using to this day. We've got clips from it because he did so much for us. So yeah, it was a good launch to the program. He was really into it. Screwed his entire day up, and I felt bad for his staff, but we got good film.
He still supports us every year. He still gives us a little bit of footage every year for our,
Awesome.
It used to be the governor's walk, but when everything shifted to virtual, we made it broader, Washington Moves, and he does a video for us every year. This year he's riding his bike.
I'm
Still
glad to hear
lots of
that.
good, strong support, yep.
Awesome.
Donna, thank you for being a champion and for being vulnerable and letting folks know, because it's wonderful. It's a really good chance for people to see really people like them taking advantage of and appreciating the program. So with the transition to WebMD, the incentive, all of that stays the same. That's not changing. It's still Smart Health. It's still going to be called Smart Health. So people won't have to like remember a new name or wonder, where did Smart Health go? Smart Health is still here. There's still going to be those activities that you can participate in to get points, and group challenges that you can join to get points. And the name, as I mentioned, is the same, and the branding is the same. And I'll show you a screenshot that shows you. The logo is the same. It'll look very familiar. But we are shifting, some things that are changing. We're shifting from the platform that is currently run by Limeade to WebMD. We're shifting from the mobile app that's currently run by Limeade to WebMD's mobile app. And there are going to be some new features that I'll tell you about in a minute. But before I do that, I want to click over to slide 10, if that's okay, and talk about a recent announcement that some of you might have heard. And we just want to give you a heads up that at the beginning of June, both WebMD and Limeade announced their intention to acquire, WebMD's intention to acquire Limeade. So this is expected to be finalized in this quarter. We've heard that they're thinking it'll be finalized somewhere in about mid-August. And from an operational standpoint, everything we've been pursuing, like we've been planning on getting over to the Limeade, getting over to the WebMD app and getting over to the WebMD platform, that's all still happening. New features that I'm going to tell you about are all still happening. We do think this acquisition could make the transition a little bit smoother than it would have otherwise been, because WebMD will have access to the brains and the data and all of that good stuff at Limeade. So I think there are going to be some positive things for us, just in terms of transition smoothness. But wanted to let you know, in case you had heard it, and even if you haven't, because you'll probably hear it soon, that we think is coming, assuming all of the necessary approvals they need get taken care of. That should happen in mid-August. So now we can go back to this, slide 5. This is the screenshot. We have access to a demo site. It's not going to be available to any employees until January, but we have a demo site that we can poke around in. So if you're familiar with Smart Health, this should look real familiar to you. The logo's the same, the font's the same, the colors are the same, but it talks about WebMD 1. And then on the next slide, this is a list of some new features that are coming that we're particularly excited about. There are more than are listed here, but I'm going to walk through these kind of briefly and then give you some screenshots. The daily habits is something I'm really excited about. You can choose from a list of plans. You can choose up to 3 at any given time, and you can focus on condition-specific things like diabetes or back health. You can focus on general health behavior like exercise or nutrition, or even general well-being, managing stress or staying connected. But you answer a series of questions, and then you get a personalized to-do list for building habits that you want to make progress in these areas. And it's time-bound, so it might just be a month or 6 weeks to help you get in the routine of building that habit. And then when you're done with that plan, you can choose another one if you want. There are also health trackers that let you chart measurements that you select over time. They can be health metrics like your blood pressure or blood sugar. You can chart, where you are on your important recommended screenings like colorectal screenings or mammograms or pap smears, or behavior that you want to be tracking. If you really want to track your sleep or nutrition, you can do that in the health trackers. Mental health podcasts, there are a lot of good things. I'll show you in a minute. Podcast videos and articles, all really high quality and relevant to our lives. So on the next slide, there is a screenshot of the habits and the health trackers I told you about. Again, we have a test user account, so I was playing around in it, and I decided to pick daily habits around balancing my diet, just eating more nutritious foods and keeping my stress in check. And then with the health trackers, I went all in, and I decided to focus on nutrition, exercise, sleep, mindfulness, and steps. And so now that I've set these up, every time I log in, I'm going to see how I'm doing and where I might be able to improve to get where I want to go. On the next slide, this shows the podcasts and the videos that I mentioned very briefly. The podcasts are specific to mental health, and WebMD partners with a company called Beyond Well Solutions, and there's an ever-changing set of mental health podcasts. They range from 2 minutes to 12 minutes in length, but most are right around 4 to 6 minutes, and topics include things like trauma and caregiving and mental health in the workplace, and even digital options for mental health care. So lots of good stuff to listen to there. And then lots of videos that many of which are recorded by WebMD health coaches on a variety of topics. You can see a couple samples here, one around healthy condiments and one around healthy snacks in the nutrition department. And in the middle, there's one on core exercises, which is really good for back health. And then on the next slide is just a snapshot of articles. So lots of us already go to WebMD when we're looking for information about our health, and there are lots of WebMD curated articles that will be available when we make that transition in January 2024. The last slide I already talked about at the beginning, but if there are any questions, I welcome them. And at this point, I welcome any questions about anything at all.
I was just going to say, because sometimes when we move from one vendor to another, it can go dead air on us. The vendor really doesn't want to work with the new vendor, and it can be very clumsy and awkward. But luckily, with this company, WebMD purchasing Limeade, I think we're expecting a smooth transition. I don't see why we wouldn't. So that kind of worked out for us in a very weird way. That was unexpected. That was unexpected. So, any questions? Thank you so much. Appreciate it. And appreciate your enthusiasm for the program. I think, during these times today, things have been difficult for a lot of people in the pandemic, and hopefully we can start getting back into taking care of ourselves, our coworkers, and this is a good way of doing it. And I think this new platform will be helpful. So
Great.
appreciate it.
Thanks, Chair McDermott.
Yep. Dave, what's going on in 2024, sir? Tab number 7.
Yes, this material is just the schedule of the 2024 board season that was included in your materials last week, but just wanted to highlight, since we are at our final meeting and near the end of that meeting, to make sure that you didn't miss this particular material, start saving dates on your calendars. The couple of things that I want to re-highlight on this particular document are the fact that most of these meetings are Thursdays, except when you get into July, then they are Wednesdays, because we've referred many times that this is the 4th board meeting we've had since last Wednesday between the two boards. And so there are just certain schedules where we need to have back-to-back meetings. And for most of the board season, we've had the SEB meeting is the first in the series, and as we got to July, for a variety of reasons that I'm sure made sense to me and people last year when we set the schedule, we flipped them. Doesn't make as much sense in real time now, so and knowing that several of you in school districts will be able to be more flexible to move over to a Wednesday in the summers, just wanted to highlight, yes, those are in fact Wednesdays when you get to July. You also see basically weekly meetings scheduled, because it's easier to cancel meetings under the Open Public Meetings Act than it is to schedule them. We would not anticipate actually having 4 meetings in July, but we won't know until we get into June exactly which of those meetings. Most likely we would need 2, in a rare occurrence 3, but it's very unlikely that all 4 of them will be needed, and fortunately there's not a calendar quirk with July 4th next year. So just wanted to highlight those things, and that our next meeting is the retreat, just a preview of a few coming attractions so that we don't have to keep passing the baton back and forth, Chair McDermott. We know that we will go over the UMP TPA report that I referred to earlier this year. We will certainly be talking about how the membership responded during open enrollment and what the enrollment in various plans and switching is that occurs between now and then, which will set the stage for broader conversations. Carrie, alluding back to your comments about next board season, and of course, Ledge will be in town by that point, by a few weeks. So we'll be talking, we'll be a third of the way through the legislative session, so there'll be some things to talk about there. That isn't everything, but we don't begin really talking about the 2024 board season until tomorrow. So those are things that I know. Maybe we'll wait till Monday, Jessica and Mackenzie. But those are some things we know will be happening then.
Dave, you are crushing the souls of your staff.
Yes. Okay, we'll wait until Monday to start talking about 2024.
Fair enough.
Friday.
Fair enough.
Yes. And so I'll just keep the baton real quick, Chair McDermott, because that does bring us to the last closing comment that I have, which is really, we have a retirement that is happening.
Actually, are we going to do public comment
Oh,
first?
you're right. We should do public comment. I'm going to hand the baton back to you.
Okay, public comment. Is there anyone on Zoom that would like to provide comments? Raise your hand. We'll go ahead and get a list going, and then we will call on you.
Yeah.
Really? Oh, yesterday we had some ants. Is this on Zoom or Teams? Can you send a link to Sue? All right. Seeing no comment from the public, this is our last meeting of the season. We're going to meet again in January for the retreat. Dave?
I already went over the preview because I skipped forward in our agenda. But the last closing comment that I have is we have a retirement that I just want to acknowledge, which is Connie, who has been one of our chief board supports, or our lead board support for the entirety of the SEB program launch. Yesterday, I could say only half of PEB's existence, but for SEB, Connie was with me from day one. With in 3 months, we're going to start having board meetings every 4 weeks. Ready for it? Let's go! And then suddenly it was 2020, and so I remember kind of being like, "We're really going to do board meetings every month for 2.5 years?" I was like, Yep, that's what it's going to take. There's no path to getting it done without that. And she just dug right in, not her heels. She dug in, sleeves rolled up, working on what was very challenging pieces for getting this program launched. Some of you are still original board members. Many of you are not. But in the early days for SEB, we had meetings every 4 weeks, and they were 8 to 9 hour meetings every single time. And honestly, even though we've had 4 board meetings in the last 7 days, I don't know how we did it. board meetings are exhausting, especially all-day ones, and to have them just consistently on the schedule, I know that it was challenging for our board members, it was challenging for our staff, and it was challenging for Connie and I. There were many late nights. There were references yesterday at the PEB board meeting about, emails that were happening at 11, midnight, 10, and that was a regular occurrence because it ended up being Saturdays, Sundays. Yep, you name it, they were happening. It was the board season that never ended from October of 2017 until July of 2019, or I think we even went into August of 2019. So we had, a very long time with this particular board. And Connie's work. And so she has been helping train the next generation of support for the board this season, and you've been interacting more with Jessica. But Connie is retiring at the end of the month. And just want to thank her for her service in really helping us with the board, especially, which is critical to getting this program launched. And just wanted to take a moment to thank her for her service publicly.
Hello, Connie. So when I showed up back at the organization, I had spent some time over at DOC, not as an inmate, but as an employee, because I said that yesterday, and I was like, oh, that sounded like I went off to corrections for a couple of years. And I came to this agency, to be honest, coming from a Medicaid background, this is an entirely different program. And to think that you can just say, well, it's like Medicaid, because it's not like Medicaid at all. And my learning curve was massive, it was steep. And Connie was my connection to the division and sort of the world and the board and how I was gonna proceed. So I honestly couldn't have done it without her. She's a tough cookie. She's all smiles and nice to the board, but she is riding herd in the back room, because all these presentations, all these things have to be harmonized. They have to make sense. They have to be formatted. They have to be written up in such a way that flows. And that's easier said than done, especially when you have 10 different staff working on 10 different presentations that are coming in at all times. And then that's just beside the fact that she was managing the division as well. So a lot of our central services all flow through the executive assistant, who's going to do the hiring and firing and make sure all this stuff happen. And so while doing all those duties, I still don't understand how you got all that done. Because back in the day, you didn't have any help. It was you. Oh, yeah, that's right. I know how you got it done. Weekends, nights, all that good stuff. So, I personally appreciate the relationship we had. She got to know my wife, my son. Although, her nickname for me was Pumpkin. And that is my cat's name. And so that was always a weird thing, but it was Pumpkin. So, and I always appreciated that. I could hear her yelling Pumpkin across the hall, and I was like, okay, here we go. That's going to be my nickname. But I just wanted to say thank you, Connie, for everything you did for the agency, for the members. Sometimes I couldn't tell if you were doing it for the people we serve, you were doing it for us, you were doing it for the person you work for. Whatever the reason was, you did it. And you did it every single day, and you brought it, and we appreciate it. Is Sue? Sue is on the line as well, and I think she would like to say a few words. Sue Birch is the director here.
Connie, hi, it's Sue Birch. Only 2 crutches and a splint would keep me from being there celebrating with you. And I just want to thank you for your incredible public service excellence. First and foremost, to all of our herb work, and certainly you've just really demonstrated what true public service excellence is. And you have been so wonderfully fun up in our executive office suite and just helping pitch in, doing whatever, keeping Dave sane, keeping the board on task and organized. So I want to thank you. We know you'll keep in touch with us in your retirement years. And we just are looking forward to celebrating what you're going to be, how this new chapter is going to play out for you. So thank you, thank you, thank you. And I hope to still give you a hug and squeeze when I see you.
Thank you,
Thanks, Connie.
Thank you, Sue. And some last comments regarding today. When we're doing good things and it's fun and we're building a program and we're, enhancing benefit design and doing things that's fun, That's kind of the easy part. And so I've really appreciated the board going through this process. It's been a very difficult board season. And it's really the measure of the character of a group is when they're facing the hard times. And it is difficult. And I know that some of you are going to have to go back and face the people who are not going to be able to afford these increases. And they're going to say, well, what am I supposed to do? What did you do? What did the board do? What did the agency do? And so I do understand that, and I do appreciate what everybody brought to bear this season. And Dave and your staff, our finance folks, everybody was working on this as hard as they could, and the end result wasn't awesome. And that's just how it is. And so hopefully in this off season, we can make some improvements. We can continue to work with KP to try and resolve some of the issues with their rates. And, I thank you. As my last act, Connie, I'm going to make you do it. I'm going to assign Connie as the pro tem chair so she can take us out for one last time. And I will go sit in the audience and watch the show.
How long do we have?
Hey, you're the chair. You can do whatever you want.
Okay, we gathered you here today for a little chat.
Well, I just want to say thank you to my favorite people in the entire world. I've got through this yesterday without crying with the PEB board. And Lou and Dave are amazing. They're like my sons. That's how old I am, 100.
Dave, we're brothers.
Yeah. That's true. But they are amazing. And working with the staff here at HCA, I retired in 2004. I was retired for 6 whole months, and I came here to help out on a temporary basis. 19 years later, here I am. And they're finally saying, it's time for you to go. So I'm going. And I'm so thrilled with Jessica and Mackenzie and Maria, of course, all these people that are taking over, and Jessica and these guys have done it the whole year. So these successes are all theirs, and they're amazing. They're 10 times better than I ever could have thought of being. They're going to take really good care of you, and I've enjoyed every single minute here at HCA, one of my favorite places in the world, and I hope you'll have a good year next year. I might call in with some comment. Of course, I'm more PEB board than SEB board. I'm going to have some things to say. But I want people to know how hard this agency works for their customer service and for the people that they serve, and how hard it is that you as board members. I know how hard this is, and I know the things that we go on in the background, how difficult that is. And the decisions aren't easy, but we're in a time of difficult situations, and you are amazing to get through and to always think of your people. And these guys, endless hours trying to make it better for you. And it was a treat to be a part of that team. So thank you. And I'm going to show you how this is used.
I know you know that.
The meeting is adjourned.